Mirtazapine, a versatile medication prescribed for a variety of conditions, offers relief to many individuals seeking assistance. With numerous applications, benefits, and potential side effects, it is important to understand this medication fully before considering it as a treatment option. This video aims to provide a comprehensive overview of mirtazapine, investigating its common uses, benefits, potential side effects, recommended dosage, and associated risks. Common applications of mirtazapine. Mirtazapine, commonly known by its brand name Remeron, is primarily used in the treatment of major depressive disorder. Depression is a mental health condition that affects millions of people worldwide, causing persistent feelings of sadness, loss of interest in activities, and a lack of energy. Mirtazapine is often prescribed to help alleviate these symptoms and improve overall mood. However, its applications extend beyond depression. In addition to major depressive disorder, mirtazapine is also prescribed for generalized anxiety disorder. Anxiety disorders are characterized by excessive worry, fear, and unease. Mirtazapine helps to relieve anxiety symptoms by altering the balance of chemicals in the brain, promoting a sense of calmness and reducing feelings of anxiousness. Furthermore, mirtazapine is sometimes used in the treatment of post-traumatic stress disorder, PTSD. PTSD occurs in individuals who have experienced a traumatic event and often involves symptoms such as intrusive thoughts, nightmares, and hyperarousal. Mirtazapine can help manage these symptoms and improve overall quality of life for individuals with PTSD. Lastly, mirtazapine is prescribed for insomnia. Sleep disturbances are common among individuals with mental health conditions such as depression and anxiety. Mirtazapine helps promote restful sleep by increasing levels of certain brain chemicals that regulate sleep-wake cycles. Benefits of using mirtazapine. The use of mirtazapine offers several benefits for individuals struggling with mental health conditions. Firstly, as an antidepressant, mirtazapine helps improve mood and reduce feelings of sadness and hopelessness. Many individuals who have taken mirtazapine report a significant improvement in their overall well-being, allowing them to regain interest in activities they once enjoyed. Another benefit of mirtazapine is its anxiolytic properties. By reducing anxiety symptoms, mirtazapine can help individuals regain control over their lives and reduce the impact anxiety has on their daily functioning. This can lead to improved relationships, increased productivity, and an overall better quality of life. Furthermore, mirtazapine has sedating effects, making it an effective treatment for insomnia. Many individuals who struggle with sleep disturbances find relief with mirtazapine, as it helps promote restful sleep and reduces the time it takes to fall asleep. Improved sleep patterns can have a positive impact on mood, energy levels, and overall cognitive function. Lastly, mirtazapine has been found to be effective in managing symptoms associated with post-traumatic stress disorder. By reducing intrusive thoughts, nightmares, and hyperarousal, mirtazapine helps individuals with PTSD regain a sense of control and stability in their lives. Overall, the benefits of using mirtazapine include improved mood, reduced anxiety symptoms, better sleep quality, and management of PTSD symptoms. It is important to note that individual responses to medication may vary, and it may take some time to find the right dosage that works best for each individual. Potential side effects of mirtazapine. Like any medication, mirtazapine carries the risk of potential side effects. It is important for individuals considering mirtazapine as a treatment option to be aware of these side effects and discuss them with their healthcare provider. One common side effect of mirtazapine is drowsiness. Due to its sedating properties, mirtazapine can cause individuals to feel excessively tired or sleepy during the day. This side effect is more common at higher doses and usually improves over time as the body adjusts to the medication. However, if drowsiness persists or interferes with daily activities, it is important to consult with a healthcare professional. Another potential side effect of mirtazapine is increased appetite and weight gain. Some individuals may experience an increase in cravings and find themselves eating more than usual. This can lead to weight gain, which may be undesirable for some individuals. Monitoring and managing diet and exercise can help mitigate this side effect, but it is important to discuss any concerns with a healthcare provider. Additionally, mirtazapine can cause dry mouth, constipation, and dizziness. These side effects are generally mild and temporary, but it is important to stay hydrated, maintain a healthy diet, and be cautious when getting up from sitting or lying down to prevent falls or accidents. In rare cases, mirtazapine may cause more serious side effects such as allergic reactions, changes in heart rate, or seizures. If any of these symptoms occur, immediate medical attention should be sought. It is important to note that not all individuals will experience these side effects, and many individuals tolerate mirtazapine well. However, it is essential to discuss any concerns or potential side effects with a healthcare provider to ensure the medication is being used safely and effectively. Recommended dosage of mirtazapine. The recommended dosage of mirtazapine varies depending on the condition being treated and individual factors such as age, weight, and overall health. It is important to follow the prescribed dosage provided by a healthcare professional and not to exceed the recommended amount. For the treatment of major depressive disorder, the initial recommended dose of mirtazapine is usually 15 mg per day, taken once at bedtime. This dosage may be increased gradually, based on individual response, to a maximum dose of 45 mg per day. However, the majority of individuals find relief with lower doses, and higher doses are generally reserved for those with more severe symptoms or treatment-resistant depression. For the treatment of generalized anxiety disorder, the initial recommended dose of mirtazapine is also 15 mg per day, taken at bedtime. This dosage may be increased if necessary, but it is important to closely monitor for any side effects or changes in symptoms. When used for insomnia, mirtazapine is typically prescribed at a lower dose of 5 mg to 15 mg per day. The medication is taken once at bedtime to promote sleep. It is important to note that mirtazapine should not be abruptly stopped, as this can lead to withdrawal symptoms. It is recommended to gradually taper off the medication under the guidance of a healthcare professional. It is important to follow the recommended dosage and any adjustments made by a healthcare provider. It may take several weeks for the full effects of mirtazapine to be felt, so it is important to be patient and consistent with the medication regimen. Risks associated with mirtazapine use. While mirtazapine is generally considered safe and effective for the treatment of various conditions, there are some risks associated with its use. One important risk is the potential for interactions with other medications. Mirtazapine can interact with certain drugs, including monoamine oxidase inhibitors, MAOIs, selective serotonin reuptake inhibitors, SSRIs, and certain antibiotics. These interactions can lead to increased side effects or decreased efficacy of either medication. It is important to inform healthcare providers of all medications, supplements, and herbal remedies being taken to avoid potential interactions. Another risk associated with mirtazapine use is the potential for discontinuation syndrome. Discontinuation syndrome refers to the onset of withdrawal symptoms when mirtazapine is abruptly stopped or the dosage is significantly reduced. Symptoms may include flu-like symptoms, dizziness, irritability, and mood changes. To prevent discontinuation syndrome, it is important to gradually taper off the medication under the guidance of a healthcare professional. Additionally, mirtazapine carries a small risk of suicidal thoughts or behaviors, particularly in individuals under the age of 25. It is important to closely monitor individuals taking mirtazapine for any changes in mood or behavior, especially during the initial weeks of treatment. Lastly, mirtazapine should not be taken by individuals with certain medical conditions, such as liver or kidney disease. It is important to disclose any pre-existing medical conditions to a healthcare provider before starting mirtazapine. How to use mirtazapine safely and effectively. To use mirtazapine safely and effectively, it is important to follow the guidance of a healthcare professional. Here are some general tips. Take mirtazapine as prescribed by a healthcare provider. Do not exceed the recommended dosage or abruptly stop taking the medication without consulting a healthcare professional. Take mirtazapine at the same time each day, preferably at bedtime, to help reduce drowsiness during the day. Avoid alcohol while taking mirtazapine, as it can increase drowsiness and impair cognitive function. Be patient. It may take several weeks for the full effects of mirtazapine to be felt. If symptoms persist or worsen, consult with a healthcare provider. Attend regular checkups with a healthcare provider to monitor progress and discuss any concerns or side effects. Do not drive or operate heavy machinery if experiencing drowsiness or dizziness as a side effect of mirtazapine. Store mirtazapine in a cool, dry place away from direct sunlight and out of reach of children. By following these guidelines and maintaining open communication with a healthcare provider, individuals can use mirtazapine safely and effectively as part of their treatment plan. Alternatives to mirtazapine for treating similar conditions. While mirtazapine is a commonly prescribed medication for various conditions, there are alternative treatment options available. It is important to discuss these alternatives with a healthcare provider to determine the best course of action based on individual needs and preferences. For the treatment of major depressive disorder, alternative medications such as selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, may be considered. These medications work by increasing the levels of certain neurotransmitters in the brain, helping to improve mood and alleviate depressive symptoms. In the case of generalized anxiety disorder, alternative medications such as benzodiazepines or buspirone may be prescribed. These medications help reduce anxiety symptoms and promote relaxation. For insomnia, alternative treatments include cognitive behavioral therapy for insomnia, CBTI, and other non-pharmacological approaches. CBTI focuses on improving sleep habits and addressing underlying psychological factors contributing to insomnia. Individuals with post-traumatic stress disorder may also benefit from alternative treatments such as trauma-focused therapy, eye movement desensitization and reprocessing, EMDR, or other evidence-based therapies specifically designed for PTSD. It is important to discuss alternative treatment options with a healthcare provider to determine the most suitable approach based on individual needs and preferences. Frequently asked questions about mirtazapine. Can mirtazapine be used in children and adolescents? Mirtazapine is not typically recommended for use in individuals under the age of 18. However, there may be exceptions in certain cases where the benefits outweigh the risks. This decision should be made in consultation with a healthcare provider. Can mirtazapine be used during pregnancy or while breastfeeding? The use of mirtazapine during pregnancy or breastfeeding should be discussed with a healthcare provider. The potential risks and benefits must be weighed carefully, taking into consideration the individual's specific circumstances. How long does it take for mirtazapine to start working? It may take several weeks for the full effects of mirtazapine to be felt. It is important to be patient and consistent with the medication regimen. If symptoms persist or worsen, consult with a healthcare provider. Can mirtazapine be used long-term? The duration of mirtazapine treatment varies depending on the individual's condition and response to the medication. Some individuals may require long-term treatment, while others may be able to gradually taper off the medication after a period of stabilization. This should be discussed with a healthcare provider. Can mirtazapine be used alongside other medications? Mirtazapine can interact with certain medications, including monoamine oxidase inhibitors, MAOIs, selective serotonin reuptake inhibitors, SSRIs, and certain antibiotics. It is important to inform healthcare providers of all medications, supplements, and herbal remedies being taken to avoid potential interactions. Conclusion and final thoughts. Mirtazapine is a versatile medication that offers relief to individuals struggling with various mental health conditions. Its applications extend beyond major depressive disorder, as it is also prescribed for generalized anxiety disorder, post-traumatic stress disorder, and insomnia. By altering the balance of chemicals in the brain, mirtazapine helps improve mood, relieve anxiety, and promote restful sleep. While mirtazapine offers many potential benefits, it is important to be aware of its potential side effects, which may include drowsiness, increased appetite, and weight gain. Additionally, mirtazapine carries the risk of interactions with other medications, making it important to consult with a healthcare professional before starting or changing any medication regimen. By understanding the common applications, benefits, side effects, recommended dosage, and associated risks of mirtazapine, individuals can make informed decisions about their treatment plan. It is important to work closely with a healthcare provider to ensure the safe and effective use of mirtazapine or explore alternative treatment options if needed.